Gentlemen, have you ever wondered if your most private habits are actually protecting your health or secretly sabotaging your longevity as you cross the threshold of 60? It is a question that many men whisper in the privacy of a clinic but rarely dare to ask out loud. Is a daily release a savior for your prostate or a silent killer that drains your vitality? Today, we are going to strip away the myths, the shame, and the confusing internet advice to look at the hard scientific facts. As a urologist with over 10 years of clinical experience, I have seen how the right frequency can transform a man's health, sleep, and confidence. Many of you have been told that as you age, you should slow down, that your energy is a finite resource that must be hoarded. But what if the science says the exact opposite? What if staying active in this specific way is the very key to preventing the issues that keep you up at night? Before we dive into the data that might just change your life, I want to know where you are joining us from today. Please drop your city and country in the comments below. It helps me understand our global brotherhood of men who are committed to mastering their health. If you are ready to reclaim your strength and protect your most vital organ, make sure you hit that subscribe button right now, because we are about to uncover the truth that every man over 50 and 60 needs to hear. We are entering a new era where decline is optional, and your journey to a healthier prostate starts right here, right now. To understand whether a daily release is truly a savior or a killer, we must first look at the biological plumbing of the male body. For decades, there has been a persistent myth that frequent ejaculation weakens a man, drains his testosterone, and leaves him vulnerable to illness. In my years of practice, I have heard patients express fear that they are using up their life force, but modern urology paints a very different picture. Think of your prostate as a small reservoir or a walnut-sized gland that produces a significant portion of the fluid that makes up your release. This fluid is not just water, it is a complex mixture of enzymes, proteins, and minerals designed to protect and nourish. However, when this fluid sits stagnant for too long, it can become a breeding ground for trouble. I often use the metaphor of a mountain stream versus a stagnant pond. A mountain stream is clear, fresh, and full of life because the water is constantly moving and being renewed. A stagnant pond, on the other hand, collects debris, grows algae, and eventually becomes toxic. Your prostate functions in a similar way. When you have a regular release, you are essentially flushing out the system, clearing out metabolic waste products and potential carcinogens that can accumulate over time. This brings us to one of the most significant pieces of medical research in recent history, often referred to as the study. This massive study followed over 32,000 men for nearly 2 decades to see how ejaculation frequency impacted their risk of prostate cancer. The researchers found that men who reported at least 21 releases per month had a 20% lower risk of developing prostate cancer compared to those who only had 4 to 7 releases per month. We are talking about a significant reduction in one of the most common cancers facing men today, achieved not through a pill or a painful procedure, but through a natural biological process. For men over 60, this frequency of 21 times a month might sound daunting, but the benefits are on a spectrum. Even moving from 5 times a month to 10 times a month can have a protective effect. The key takeaway here is that regular activity acts as a form of internal hygiene for your prostate. Now let us address the elephant in the room, which is testosterone and aging. Many men fear that frequent release will lower their testosterone levels, making them feel tired, weak, or less masculine. However, the science shows that while there is a very brief dip in testosterone, immediately following a release, the levels bounce back quickly, and in the long term, regular sexual health can actually support healthy hormone production. In fact, the act of release triggers a cascade of beneficial chemicals in the brain. You get a surge of oxytocin, often called the cuddle hormone, which lowers stress and promotes a sense of well-being. You get a release of dopamine, which is your brain's reward chemical, and you get a significant drop in cortisol, the primary stress hormone that can cause inflammation and heart disease. For a man over 60, managing stress and inflammation is perhaps the most important thing he can do for his longevity. High cortisol levels are linked to belly fat, high blood pressure, and even the enlargement of the prostate, a condition we call benign prostatic hyperplasia. By engaging in regular release, you are essentially giving your nervous system a reset button, helping you sleep better and feel more relaxed throughout the day. Better sleep is particularly crucial because it is during deep sleep that your body produces the majority of its natural testosterone. We must also talk about the silent killer aspect of this topic. Is there ever a time when frequent release is bad? The answer lies in the quality and the context. If a man is using high-intensity digital stimulation or explicit content to achieve this frequency, he may be inadvertently desensitizing his brain and his nervous system. This can lead to what we call induced dysfunction, where the body becomes so used to an artificial level of stimulation that it struggles to perform in a real intimate setting. Furthermore, if the act of release becomes a source of stress compulsion, or if it is done with excessive physical force, it can cause micro-trauma to the delicate tissues of the pelvic floor. For my patients over 60, I always emphasize that the goal is health and connection, not just hitting a number on a chart. We also need to consider the physical mechanics of the prostate. As men age, the prostate naturally tends to grow. This growth can squeeze the urethra, leading to that all-too-common problem of having to wake up multiple times at night to go to the bathroom. While regular release helps flush the gland, it is not a magic cure for an already enlarged prostate. This is where we must integrate other pillars of health. Your nutrition plays a massive role in how your prostate reacts to these changes. I always recommend that men over 50 and 60 focus on lycopene, which is found in abundance in cooked tomatoes. Lycopene is a powerful antioxidant that specifically targets prostate tissue and has been shown to reduce inflammation. Pairing your regular release habits with a diet rich in healthy fats like avocados and walnuts can provide the building blocks your body needs for hormone production. We also cannot ignore the importance of zinc and selenium. Zinc is found in high concentrations in the prostate and is essential for maintaining the integrity of the cells. When you have a release, you lose a small amount of zinc, so it is vital to replenish it through foods like pumpkin seeds, oysters, or a high-quality supplement. Another critical factor for men over 60 is the health of the pelvic floor muscles. These are the muscles that support your bladder and your prostate and are responsible for the strength of your release. Just like any other muscle in your body, if you do not use them, you lose them. This is why I often prescribe Kegel exercises for my male patients. By strengthening these muscles, you not only improve your control and performance, but you also increase the blood flow to the entire pelvic region. Improved blood flow means more oxygen and nutrients are reaching your prostate, helping it stay healthy and resilient. Now let us talk about the method for hydration, which I have developed to help men manage their nighttime bathroom trips. Stands for Adjust, Soften, Integrate, and Manage. You adjust your water intake so that 75% of your fluids are consumed before 4 in the afternoon. You soften your intake in the evening, meaning you take small sips rather than big gulps. You integrate electrolytes like a pinch of sea salt or a squeeze of lemon into your water to ensure it actually enters your cells rather than just running through you. And finally, you manage your environment by avoiding caffeine or alcohol late at night. When you combine this hydration strategy with a regular schedule of release, you are attacking prostate issues from 2 different angles. You are keeping the gland flushed and healthy while also reducing the pressure on your bladder at night. I want to share a story about a patient of mine who was 68 years old. He came to me feeling very discouraged. He was waking up 4 times a night to urinate. He felt his energy was low, and he had completely stopped being intimate because he felt he was too old for that sort of thing. We started by looking at his data and realized his prostate was slightly enlarged, but more importantly, he was stuck in a cycle of stagnation. I encouraged him to adopt the hydration method and to reconsider the importance of regular release as a medical necessity for his prostate health. Within 8 weeks, he reported that he was only waking up once a night. His mood had improved significantly, and he felt a renewed sense of confidence. He realized that his body was not broken, it just needed the right maintenance. This is the message I want to drive home for you today. Your body is a high-performance machine, and like any machine, it requires regular use and proper care to stay in peak condition. The idea that men should become asexual or stagnant as they age is a cultural myth that is not supported by biology. In fact, maintaining your sexual health is one of the best ways to ensure you stay vibrant and independent well into your 80s and 90s. However, I must also give you a few warning signs to look out for. While regular release is generally a savior, you should seek medical attention if you experience pain during the process, if you notice blood in your fluid, or if you find that your flow of urine is becoming increasingly difficult to start. These can be signs of infection or other issues that require a urologist's intervention. But for the vast majority of men, the truth is clear: your body was designed for movement, for circulation, and for release. Do not let shame or outdated ideas keep you from the health benefits that are your birthright. Focus on the quality of your habits, nourish your body with the right minerals and vitamins, and stay active in every sense of the word. When you do this, you are not just protecting your prostate, you are upgrading your entire quality of life. You are becoming the kind of man who leads with confidence, who sleeps soundly, and who understands that his best years are not behind him, but are happening right now. It is about taking ownership of your health and realizing that small, consistent actions lead to massive results over time. Whether it is changing what you put in your morning coffee, adding 15 minutes of walking to your day, or embracing the benefits of regular release, every choice you make is a vote for the man you want to be. I have seen thousands of men turn their health around by simply following these science-based principles. It does not require expensive drugs or complicated surgeries. In most cases, it just requires a willingness to listen to your body and give it what it needs to thrive. Remember that the 21 times a month figure is a goal to strive for, but any increase in your current activity level is a step in the right direction. Listen to your body, be patient with yourself, and focus on the long-term journey of health. You have the power to influence your biology, to protect your prostate, and to live a life of vitality and purpose. To expand on the nutritional aspect, we must look at the role of cruciferous vegetables. Cauliflower and kale contain compounds that help the liver process excess estrogen, which can sometimes accumulate in older men and contribute to prostate growth. By keeping your estrogen levels in check, you allow your natural testosterone to work more effectively. Furthermore, the health of your cardiovascular system is directly linked to your prostate health. The same blood vessels that supply your heart also supply your pelvic organs. This means that a heart-healthy diet and regular aerobic exercise like brisk walking or swimming will directly improve the function of your prostate and your ability to maintain a regular release schedule. We also need to consider the impact of vitamin D. Many men over 60 are deficient in this crucial vitamin, which acts more like a hormone in the body. Low levels of vitamin D have been linked to an increased risk of prostate issues. I recommend getting your levels checked and spending at least 15 minutes in the sun each day, or taking a high-quality supplement. Another often overlooked factor is the gut microbiome. Recent studies suggest that the bacteria in your gut can influence inflammation throughout the body, including the prostate. Eating fermented foods like yogurt or taking a probiotic can help maintain a healthy balance of bacteria, which in turn supports your immune system and reduces the risk of chronic prostatitis. When you combine all these elements, a healthy release frequency, proper hydration, targeted nutrition, and regular exercise, you are creating an environment where your prostate can thrive. You are moving from a state of survival to a state of optimization. This is not just about avoiding disease, it is about maximizing your potential as a man. You deserve to feel strong, energetic, and capable regardless of the number on your birth certificate. The science is clear and the path is laid out for you. It is time to take the first step toward a healthier, more vibrant version of yourself. As we wrap up this deep dive into your health, I want you to remember one thing: you are not broken, and you are certainly not too old to prioritize your vitality. The information we have discussed today, from the protective power of regular release to the hydration method and the importance of specific nutrients, is designed to give you a roadmap for a stronger, healthier future. My mission as a urologist is to empower you with the knowledge that usually stays behind the closed doors of a medical office. But I want to be very clear about one thing: while the information I share is based on clinical experience and scientific research, it is for educational purposes only. Every man's body is unique and your health history is personal. This video does not replace the need for a one-on-one consultation with your own doctor. If you are over the age of 50, it is vital that you have regular checkups, including tests and physical exams, to monitor your prostate health accurately. Never ignore red flags like pain, blood, or significant changes in your urinary habits. Always consult with a healthcare professional before starting new supplements or making major changes to your routine, especially if you have underlying conditions like heart disease or diabetes. That being said, the strategies we have covered today are powerful tools in your health arsenal. I want to see you thrive, not just survive. If you found this information valuable, the best way to support this mission is to engage with this content. Please hit the like button right now. It tells the algorithm that this health information is important for men everywhere. If you have not already, hit that subscribe button and turn on the notification bell so you never miss a strategy to upgrade your life. I also want to hear from you. What was the most surprising thing you learned today? Leave a comment below with the word START so I know you are committed to taking action and improving your intimate health. Sharing this video with a friend, a brother, or a father could literally change someone else's life. Let us build a community of men who are informed, confident, and proactive about their health. Thank you for spending your valuable time with me today. Remember, health is your greatest asset, and small changes today create a different world for you tomorrow. Keep learning, keep growing, and keep taking care of yourself. I will see you in the next video where we will continue to unlock the secrets to your best life. Stay strong, gentlemen.